Happy Friday, everybody, and welcome to everybody's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, influencer Anna Bulgini is dead after a botched plastic surgery, but crazily, she partied with her plastic surgeon the night before. It's a wild story. And then, tummy tucks. Do you continue to lose weight after you have a tummy tuck? There's some new research that says that you do. And then finally, InMode's Quantum, new technology for soft tissue tightening. It's brand new. I went and did some training on it this week, and I'm going to tell you all about it. It's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like, subscribe button, turn on those notifications. I'm your host, plastic surgeon Dr. Bruce Hermann. And with me, as always, is Sarah.
Hi.
Hi, Sarah. Did you like that intro?
Yeah.
I'm not sure it was as good as last week's, but Travis, how are you, man?
I'm good. How about yourself?
Doing good. Anything cool and new?
I'm supposed to be going to an act off tonight.
An act off?
What the heck is that, dude?
Sarah's face.
Is that like an improv thing?
Kinda, sorta. So basically, I think they have a scene. There's like, I think there's 12 actors that are supposed to perform like a scene.
Wow.
And I'm supposed to be a judge.
You're a judge?
Yeah.
For through the radio?
No, it's not through the radio. It's like through social media. Somebody reached out to me that
Wow.
is an actor friend of mine. And
Dude,
I'm
that's
supposed
so
to
cool,
really
man.
fun.
Who was the best, I guess.
Where's that going down at?
I have to get the address.
Oh, you're not sure?
It's on the flyer, but I don't remember it offhand.
That's pretty sick.
Yeah, it seemed pretty alright.
So have you guys ever heard of Akai in Dallas, AKAI?
Okay. It sounds kind of familiar.
So we're going out for our anniversary, which was last week. We're actually like going out tomorrow, and so it's like this like hidden Tokyo lounge. Anyway, so I'm gonna check that out. It's apparently like really hush hush, and it's like one of those things where you go into like a restaurant and then it's like a secret door that's like a mirror.
Oh, like a
speakeasy.
Yeah.
Yeah. So anyway, we're gonna check that out.
That
All right. So
sounds fun.
What are you doing? You doing anything crazy this weekend, sir?
I'm going to like a 4th of July party.
Oh, nice.
Hey.
Yeah.
Nice. All right, well, we're going to have to do full reports next week on how the weekend's going because we all got some interesting stuff going on.
Yeah.
So, all right, we'll look forward to that. All right, let's move on to some segments. All right. Man, this story is pretty wild and obviously very, very sad. Have you guys heard of Anna Bulgini? I hadn't heard of her. Trey, Anna Bulgini?
No, not familiar.
Yeah, I didn't recognize her either, but she's apparently a pretty big influencer. So this is about influencer Anna Bulgini, who died after plastic surgery. And the craziest part is, and this is like in the headline of the article, is that apparently she had surgery just hours after partying with the surgeon the night before. This one's nuts, man. This is just crazy. This did not happen in the United States. Not that crazy things don't happen in the United States.
Is she an influencer from America, though?
She's not.
Okay.
No, she's not. So Anna Bulgini's 31 years old. Sadly, she just got married last month. She's originally from Brazil, but is currently like working out of Mozambique. And she's like a singer. Like I checked out her social. Like she's actually a pretty, it seems like accomplished pop.
She's like relevant.
Yeah, she's not just like an influencer, doing opening videos or whatever, right? Like she actually has, some talent. So singer, model, social media influencer, and she has like 1 million followers.
Yeah.
So she traveled to Istanbul, Turkey.
Got it. Have you seen all those videos about like whenever somebody's going to Turkey and they like an airline and they take a video and it's all these guys with like hair plugs?
Oh, dude, it's so funny you mentioned that. Somebody was just commenting to me that Turkey is like the big place to go get hair plugs.
Yeah.
I think it was my wife.
It's like like every airline coming and going from Turkey.
Well, Turkey is like the plastic surgery medical tourism place for the Eastern Hemisphere. Like people from Europe go there because it's like where people go to, Mexico or Costa Rica here in the Western Hemisphere.
Right.
Because plastic surgery is dirt cheap over there. But like, there's been a lot of warnings coming from various governments, like in the EU, about like, this is dangerous, don't do this.
Right.
So she went to Istanbul, Turkey with her husband to the TUSA, T-U-S-A hospital. And the whole story is bizarre. So first off, she got a deal where she was getting the surgery for free if she would promote it on her Instagram.
Okay.
So I mean, I guess there's nothing crazy about that, but it just is not traditional for sure. So she wanted to get a breast augmentation, liposuction, and a nose job. So she went and she had her consult, I guess on a Friday. And then Saturday, I don't know how this goes down, but she ends up hanging out with the surgeon, her and her husband. And apparently they go partying all night. And I guess during the party session, the surgeon convinces her to come into the clinic on Sunday to get her surgery done, because her surgery is initially scheduled for like Tuesday or something. So they go back on Sunday, and the husband's saying that basically they were out almost all night and then came in a few hours later.
Hangovers.
I know, right? All of it sounds bad, really, really bad. So they're out partying with the surgeon. They come in on Sunday. As I said, the husband says there was just a few hours after they got in. Well, here's the weird part. So the news article says that she didn't get out of surgery until 11 p.m. Like, that's crazy. I mean, I'm assuming. All day?
Like it started in the morning? I
would assume, because if it says that they had the surgery just hours after they were partying, you would assume that the surgery happened on Sunday morning, right? As opposed to like late in the day. And so again, I'm trying to get this from news articles out of Turkey and the EU and stuff. So 11 p.m., which is bizarre. I mean, breast aug stuff, couple hours, nose job, couple hours, maybe. Liposuction, hour or two. So I don't really know what that was about. The husband also claimed that they didn't make her NPO. So that basically means, when you go to have surgery, you're not supposed to eat anything for at least 8 hours, or longer, before you have the surgery, because you could risk regurgitating and that getting into your lungs. Yeah, right. So he's claiming that they didn't do that, which would be really, really bizarre. And then, so they came out and they told the husband, everything's fine, she's in recovery, you'll be able to come see her like in an hour or something. Well, apparently like multiple hours go by and nothing. And then finally one of the doctors comes out and just says, yeah, your wife is dead. Like that was basically it.
What the heck?
Yeah, so the doctor said that she went into VFib. So VFib is basically where the heart goes into a very dangerous rhythm where the ventricles are just kind of quivering, and so you're not really getting blood. And then she went into cardiac arrest, and then it says that they tried to resuscitate her and were unable to resuscitate her.
Right.
All right, so what happened? I have a pretty good idea of what happened. I mean, these surgeries are not surgeries that should potentially be life-threatening at all. I mean, breast augmentation, it would be insane for someone from the surgery itself. Now, anesthesia is always a potential risk,
right.
And we've had patients we talked about that die from breast augmentation, but it's usually anesthesia issues. Like
right.
They're trying to do them under local anesthesia and they get too much, lidocaine or whatever. But the surgery itself should have a 0% risk of death. Nose jobs, basically the same. They're just not surgeries where there's big blood vessels or critical structures close by that really could be, injured. Anesthesia complication, that's always a possibility. However, they said that she went to recovery in good condition, so that would usually preclude an anesthesia issue. Liposuction, we've talked about liposuction and how it can be deadly where, people's organs get stabbed.
Yeah.
That is a possibility. I would say.
Where was she getting liposuction? Like in her stomach?
It doesn't say where.
Oh.
We're going to talk about whether or not she had these surgeries in a minute. I would say that the most likely patient that's going to get a severe injury from lipo would be a heavier patient, not a skinnier one. It's easier to lose your way when people are really thick, and so I'd say it's probably not that, but I did some investigating, and I'm pretty sure I know what happened. So throw up that first picture of her. It should be a side-by-side tray of her face. Yeah. So see those circles on her cheeks? Those are the classic circles for somebody that's getting fat grafting. Those are not tattoos. She does have face tattoos, but those 2 circles are not face tattoos. Because I looked at her Instagram, and that's her in the surgery place, like
right before she's about to.
Right before she's about to go back, yeah.
So she was getting fat put into her face?
Yes, that's the thing. And so if she was getting fat grafting, then
instead of like other people would get
use fillers. Yeah.
Okay.
Right, yeah, because cheek fillers are a big thing. You know, they're actually really, really nice. And one alternative is to do fat grafting. I'm not a huge fan of fat grafting in the face. Like I don't like fat grafting a ton. I do it from time to time, but with the downsides, like I'm just not a huge fan. But one of the risks of fat grafting, as we all know from discussing BBLs, is if you get fat into your bloodstream, it is very, very high risk of death. And the way that you die is you go into cardiovascular collapse, which is exactly what happened to her. So they didn't mention fat grafting, but those circles are one, that's an area where you would get fat grafting. You see there's some even along her jawline.
Yeah.
So my guess is that she got a fat embolism. That's far and away the most likely thing, because it just all makes sense.
Yeah.
So anyway, really sad story, and we'll kind of reflect on maybe some of the warning signs. I was curious about why she was getting these surgeries. I mean, liposuction, double that first pic tray. This girl is like super fit. I don't know where they were planning to get fat off of her. I mean, I looked at a bunch of photos, and she is fit. Now, she's kind of muscular, so, she's not rail thin, but there is not really any fat on her.
Yeah.
Another reason why I don't think it was just liposuction for liposuction, I think that they were trying to harvest fat to graft it.
Right.
And so then that also makes sense. And then, what's the next one? Her breasts. Like, she doesn't need she already has, those are implants. Maybe those views aren't the best, but she has the classic telltale sign of having implants. Which means she probably was having implant revision. They just said breast augmentation, but I would assume that she was having an implant revision. And then nose job, I think I do pictures of her nose up there. I think her nose looks great.
Yeah, why would she need a nose job?
I don't know. She's somebody that I definitely would have tried to talk out of like most of the procedures. Now, if she has some issue with her implants and she needs them swapped, that's a totally different story.
She's probably trying to make it more like a swoop.
Maybe. I don't know. I looked at her nose and I was like, man, I wouldn't touch her nose. Because, when people have like something that looks really good, I'm very hesitant to try to do surgery to make it better, because, you could end up it not being different or it being worse.
Yeah.
So I definitely question like the decision tree. And I don't want to put it on her, because, you might say she should know better, but it's on the surgeon to talk people out of doing stuff that's bad. There's a lot of warning signs in here. I do not like medical tourism. One thing that's noteworthy is they did not mention the doctor. They only mentioned the facility, which means that she went to a facility instead of a doctor itself, which is a bad idea. I hate those places where it's like it's a corporation and you're going and they just kind of fill in the surgeon with whoever, because you don't know who your surgeon is.
Right. It's not like you're going to McDonald's and you're going to consistently get the same product.
Cook.
Yeah.
Exactly, right? And so I just think that there's a much higher risk of bad outcomes when people go to a place where they're not going to a particular surgeon, because you don't have that ability to do your research and make sure that, are they certified? Do they have good results? You're just showing up and they hand you a surgeon and who knows who they are.
Yeah.
There have been a lot of warnings out of Turkey. I would never go to Turkey for anything personally. Not for surgery. Because these stories from there are very, very common. And then the part where like they went and partied with a surgeon all night before and then did surgery and then they changed the date. There's just so many bad things about this story.
That sounds so weird.
Yeah, I get it that she's an influencer and maybe the surgeon was like, oh, let's go have a drink, and then it like kind of devolved into like partying all night. But like, don't do that the night before you're supposed to go have surgery. And like, why did they change it anyway? The whole story is bizarre. I'm sure there's probably going to be more come out of it.
This is gonna sound really silly,
okay.
But I'm like, I feel like one of them was on some type of like stimulant to be like, yeah, let's go do your surgery.
maybe it was
like the doctor or something was like,
yeah, maybe it was like a decision made at like a bad time, you know.
Like did more than just drinking, and that's why
maybe.
he was like,
I mean,
let's get it done now.
Yeah,
like,
who knows? I mean, I just don't know
over.
how they open this. I guess the surgery center or the surgery place runs 7 days a week or something. Who knows? I don't know how things run in Turkey. Like here in the United States, you won't go to a hospital to get surgery like that. You go to like a surgery center. But this thing said hospital, which sometimes surgery centers will have the name hospital after them. So who knows? But yeah, I mean, it's a really sad story. I mean, there's definitely a lot of warning signs there that, you know, probably would have been hopefully signs that maybe you should tap the brakes. But
That's scary.
yeah, it didn't happen. And yeah, it's really sad. Like they just got married and, you know, it's crazy. So, all right, I'm going to recap this one real quick, Trey. So today we were talking about Anna Boldrini, who's a influencer, singer, and model, originally from Brazil, living in Mozambique, that went to Turkey to get plastic surgery. And this story is wild. So apparently her and her surgeon went out the night before and allegedly partied all night and then came in on a Sunday, which was not her normal OR day, to do the surgery. She apparently had some breast surgery, liposuction, we think fat grafting, and nose job, went to recovery, and then went into cardiac arrest. And unfortunately, despite attempts to resuscitate her, she passed away. Based on what I learned from looking at this, I'm pretty sure she had fat grafting. There are pictures of her the day of surgery that show the telltale signs that she was going to get fat grafting. Fat grafting does have a notable risk of fat embolism, which does cause cardiovascular collapse, which is exactly what happened to her. We also discussed that this girl really didn't look like she needed any surgery. She was very fit and beautiful, and we questioned if the surgeon maybe should have potentially talked her out of doing some of these things. But yeah, lots of warning signs on this one. Not a big fan of medical tourism. There've been a lot of warnings about going to Turkey to get surgery from various countries because the bad outcomes like this, unfortunately, are not that uncommon. So anyway, sad stuff.
Very sad.
All right. So I actually saw an article this week, and it's something that not a lot of people talk about, but it's something I absolutely noticed and do talk about with my patients from time to time. And it is, do you have continued weight loss after a tummy tuck? Now, you do lose weight when you get a tummy tuck, obviously, because you're removing stuff. And so this is something that I've actually seen in my practice. I consider myself a specialist in tummy tuck. After plastic surgery, I did a fellowship in cosmetic breast and body, and I do on average 1 tummy tuck a week. I've been in private practice for 15 years, so I think I've done somewhere around 700, 800 tummy tucks. Just guessing. I've never actually really counted them. So what happens when you get a tummy tuck? Like, what weight do you normally lose? Well, part of tummy tuck is always removing skin. Okay. So, I mean, I don't think a lot of people realize how much skin you take off. What would you guys guess? I mean, I don't know if I've ever said this. I'm gonna put you on the spot, and there's no right or wrong answer. Trey, I know you chomp the bit. How much skin's average removal in a tummy tuck?
Is it like percentage? Like
no, wait, pounds. Pounds.
Oh, pounds?
Yeah, pounds.
I'll say 10 pounds.
10? Okay.
5.
Okay, Sarah's closer. So the average tummy tuck skin removal, at least in my practice, and this would be pretty consistent across a lot of practices, is about 1 to 4.
Okay.
1 to 4 pounds. Now, I've done as big as 8 pounds on a tummy tuck. Anything bigger than 8, then likely the patient is too large to really safely have the surgery. So 1 to 4 is common. I commonly get maybe 5 or 6. The biggest I've done is 8. So you get that weight loss, but then it's also very common to do liposuction.
Yeah.
With the tummy tuck, like not separate from the tummy, but on the tummy just to make it even. So, average pulling fat out would be 200 to 500 cc's. Fat is a little bit less dense to the water. I don't know if you guys are physics nerds like I am, but if water in cc's is equal to grams. So 100 cc's or 100 mLs of water is equal to 100 grams. Fat's a little bit less dense. It's about 90% the density. So if I take out 500 cc's of fat, that's equal to 450 grams, which is about a pound. So you're looking at 1 to 4 pounds of skin, a half to 1 pound of fat. And so that's what you would normally lose in a tummy tuck, right?
Okay.
So if you get on a scale the day of surgery and weigh yourself, the average person is going to lose about 5 pounds, all right? But it's a little bit more complicated because the surgery causes you to gain water. So a lot of times people's weight's about the same, but then they flush out the extra water.
Right.
And long story short, in a few weeks, you should be about 5 pounds down. So I have noticed in my practice that I have patients tell me, because we get so many people that get tummy tucks and we do have them follow up, that they tell me it's much easier to lose weight after they have a tummy tuck, okay? I mean, and it's not just one patient. I have people tell me this all the time because I like to talk to my patients. I don't like just come in and say, oh, you look great, get out of here. Just say, how you doing? Are you happy? Like, you notice anything different? And I've had many, many patients tell me that it is much, much easier. And then I saw this article, throw up that picture. It should be an article tray, yeah. So this is from Newswise. I'm not familiar with Newswise. They're a new one to me. But this article popped up in my feed, patients continue to lose weight in the years after tummy tuck. I clicked on it and it quoted a recent article that came out from PRS, which is Plastic and Reconstructive Surgery Journal, this month. And I'm gonna throw that article up there for you guys if you wanna see it, but I'm gonna kind of go over with you. So this is the article and it says, what happens to weight following abdominoplasty? Analysis of 188 consecutive cases. So I actually read the article and it basically said what I would say, which is that it's very common for patients after a tummy tuck to lose weight. So in this study, their average pre-op weight, 168 pounds, BMI 27. At 3 months, the average patient lost 5.7 pounds, which is exactly what I kind of came up with, yeah. At 5 years, the average weight loss was 10. And you can see a gradual progression of weight loss. And I actually pulled a graph from that study right there. So that's weight in time. And you see that it kind of bounces around, but the overall trend is downward, right? And that's over 5 years, not just a few weeks after surgery, okay? So this study confirmed, and it's not a huge study, 188 patients, it's pretty good size. This study confirmed that most patients, and it wasn't all, I think in the study it said that 60% of the patients lost weight and 30% and change either stayed the same long-term or some gained, which does happen, but the majority lost.
Well, that's good news because I feel like a lot of women that get tummy tucks are worried that they're going to mess it up.
Right,
later.
or they're going to gain the weight back. That's another common question I get with tummy tucks is, and even liposuction, it's like, if I have this weight removed, is my body just going to try to gain it back? And the answer to that is no. It's not like your body senses that suddenly you lost 5 pounds of fat and it's like, oh my gosh, I lost 5 pounds of fat. Let me start storing more fat. However, it also doesn't mean that your body can't put fat on if you start to increase your intake and decrease your exertion, right?
Okay.
So it doesn't prevent you from gaining weight, but also on the other hand, your body doesn't try to gain weight because you lost it. So this study basically confirmed what I had seen in my practice and what I firmly believe. And so, the next question is why is this?
Okay.
And I know the answer to this because of just talking to patients and just knowing the anatomy. The study basically said, this is something that people have talked about and no one really knows why, but this is why we think. And it had 4 reasons, and 3 of them I totally agree with, and one of them I hadn't really thought about, but I kind of agree with it now that I said it. But the number one thing is that the most common patient that's going to get tummy tuck is women after pregnancy, right? Far and away the most common. The other one you sometimes see is patients that had weight gain, weight loss, all right?
Yes. Yeah.
Which is the same thing that's really going on with pregnancy.
Yeah.
So when you have pregnancy or weight gain, weight loss, what happens is the abdominal wall, which is very tight whenever we're young, or if you've stayed fit your whole life, it'll stay tight most of your life, gets stretched out.
Yeah.
Okay? And the abdominal wall sits right in front of your stomach. And so when that abdominal wall gets stretched out, suddenly your stomach can expand much bigger before it starts to feel pressure. And it seems that when your abdominal wall gets stretched out, you don't get full as quickly. So what happens? You eat more, okay? Now what happens when you do a tummy tuck? Well, you take that abdominal wall, which is stretched out, and you tighten it flat with sutures, and then suddenly your stomach can't expand anymore, and you get full faster. And I know that this is the case because when I ask patients, why they think that they're losing weight long-term after a tummy tuck, many of them have told me, I don't eat as much. I get full quicker, and suddenly it all makes sense. And I made an infographic. I actually made this. It wasn't bad. You throw that next one up there, Trey? Or missing Trey? Trey may have gone. Well, there it is, yeah. So I actually made that, so it turned out pretty good. So you can see there in the picture on the left, the girl's kind of got a rounded stomach, And then when it's flat, like you can imagine that the inside has a lot less room.
Yeah.
Right? And so that was the very first thing that this article said is very likely due to increased satiety, satiety, S-A-T-I-E-T-Y, satiety?
Yeah, something like that.
Yeah. Due to stomach compression. The other is, and I totally agree with this one.
She looks unhappy in both of them.
I know, I should have like tried to make it where she was smiling. That's an AI created photo, but it actually did pretty good. I was trying to have it create like an infographic.
Yeah.
It's not bad, not bad.
That's good.
The other thing that the article said, which I totally agree with, is that after a tummy tuck, it's easier for people to exercise. You know, when you have that extra skin and your abdominal wall is really loose, it can be uncomfortable to exercise. And when you fix that, it's easier to exercise, so people have more exertion and they lose weight. The third one is that once people get a tummy tuck or any plastic surgery for that reason, they often kind of have this new outlook where they're like, hey,
I have to take care of myself.
Exactly right. I have to take care of myself. I'm looking good. And
so all this money.
They change, right. I spent this money. I don't want to wreck it. And so they have lifestyle changes, and then that furthers their weight loss. And then the last one that they mentioned was improved metabolic function due to fat removal. I'd never thought of that one. It is possible, like when you have larger amounts of fat, it can change your metabolism a little bit. And so it could be conceivable that debulking the fat would alter your metabolism. I'm not sold on that one. I'm kind of like, yeah, maybe. I mean, I've heard that higher fat content does affect metabolism. So that one's a maybe.
Yeah.
So, I think this is an interesting, it was an interesting study because it kind of confirms something that I've thought all along, that, when you do tummy tucks, the change to the anatomy gives you benefits that will allow you to continue to lose weight, which is good.
Yeah.
Tummy tucks are really, really popular. Again, they're popular because a lot of the changes that occur with pregnancy or weight gain, weight loss, you can't fix in the gym.
Yeah.
We've talked about this on different segments when we've talked about, abdominal stuff. If your abdominal wall is stretched out, like it doesn't matter how many crunches you do in a day, it doesn't fix it. There's no way to fix it outside surgery. And the same thing with loose skin. And those are the two major things that we tackle when we're doing tummy tuck, with the third one being fat, like sucking out fat. And when I say cutting off skin, I mean, it does include fat. Like it's a big sheet of skin, but then the fat's underneath it, and that's where the weight comes from, because skin's really not that heavy.
Yeah.
But yeah, interesting stuff. This is one that people don't think about, and I don't try to sell people on tummy tuck by saying, oh, you're gonna lose more weight, because if they don't, then I would.
They're gonna be back in your office.
Yeah, right. So I mention it if people ask about it. I'll say, well, now I can say, well, there's a study that shows, but I used to say, well, in my experience, I found that patients lose weight a little bit easier.
Yeah, well, both of my sisters want to get tummy tucks because they're both going through their weight loss journey after like having their kids and stuff. Yeah.
All right, let me recap this real quick, Trey. Today, we were talking about a new research paper that came out that showed that women who have tummy tucks, or men for that reason, will continue to lose weight beyond the weight loss that happens from the surgery, which means the fat and the skin and that we take off in a tummy tuck or abdominoplasty. And this is something I've seen in the 15 years I've been doing tummy tucks, is that patients tell me it's easier to lose weight after a tummy tuck than before. And this research paper confirmed that. Patients lost on average 5 pounds from the surgery, and then the majority of patients continued to lose weight, with the average being about 10 pounds out at about 5 years. And so the next question is, well, why did this happen? Well, this is something I know about too after talking to patients. When you do a tummy tuck and you tighten that abdominal wall, it prevents your stomach from expanding, and so you feel full quicker, and therefore you eat less. Also, removing that skin and fixing the abdominal wall makes a lot of people feel like they can exercise easier, so these people are more active. Also, people will feel like that, hey, I've had this transformation, I don't want to wreck it, and they will do lifestyle changes. So it was a very interesting article. It's something people don't really talk about at all when they're talking about tummy tuck, but something I've seen in practice. And it was kind of cool to see a research paper that kind of confirms something that I'd seen all along. So cool stuff.
That's good news, honestly.
Yeah, it is good news. Yeah.
And real quick too, Cindy Hermann, she said, haha, Sarah, I thought the same thing. Why did he make her look so sad, especially after her tummy tuck?
That was AI that made her feel sad. And I look, what's funny is when that little cartoon looks sad, I was like, do redo the prompt and tell it to make her look happier afterwards? Yeah.
She's like, oh, my stomach's big. And now she's like, oh, I have a scar.
Well, she might be sad because she doesn't have a belly button on that picture. I don't know.
Yeah. I think it's funny, like how like the AI also made her clavicle bones more noticeable as well.
Yeah, it looks like she's lost weight. Well,
Yeah.
she lost weight because it's easier to lose weight after a tummy tuck.
That's
Obviously, right?
Very true. Very true.
All right, let's jump into our last one. Now, do you do med spa stuff?
Do I do what?
You do med spa stuff?
Yeah, I don't know what I thought you said. You just said it so fast.
Oh, sorry, I didn't
I was
mean
like,
to scare
what
you.
did you say to me?
Say what? Did you-
No, not very often. I mean, I go see you to get Botox, and that's about it.
That's about it. Okay. Well, I'm going to do a segment on a fairly new technology that you are going to see in med spas coming up very quickly, if not already. And this is the InMode Quantum, a new fat removal and possibly skin tightening procedure.
Ooh.
Isn't it fancy looking? Yeah.
Looks like
pretty
it
cool stuff.
hurts.
It's actually not too bad.
Is it pointy
I
at the
I did
end?
one for the first time yesterday.
Oh.
And also too, like we do have this. I'm not telling you to come in and get this from me. This is trying to be informational. I'm not saying come to my place and get
Yeah,
this.
he
But
is. He wants you to come
no,
see it.
I'm really not. I'm just trying to educate. It's new, and I didn't know much about it, and now I had to go and do training for it. So now I know about it,
Yeah.
and I am gifting that knowledge to the internet and to the world and to you.
I'm excited. I
Not
want to
that you
hear
need
about it.
I'm just saying. Okay. So there are tons of non-surgical treatments out there. Some are great, some are junk. I try to get only the better machines.
Yeah, like that, like the one that's like cold, like the cold treatment
yeah,
that like says it removes fat and tightens skin.
Cool sculpting.
But
Yeah, I
you're
don't like that one.
That one sucks.
I actually had that machine for a while when it was new, and I quit using it because I
You didn't like the results.
I didn't like the results.
Yeah.
Sometimes it was good, but sometimes it
I
wasn't.
get ads all the time for that
Huh?
crap. I
For
get
cool
ads.
sculpting. Yeah. I'm not a fan of cool sculpting. So, but there are some really, really good machines out there, and InMode is one of the big ones. We've talked about Morpheus a lot on the show.
Yeah.
We have a Morpheus machine. I love it. Kim Kardashian talks about Morpheus. Everyone talks about Morpheus.
But is that more for your face or is that whole body?
It's either or.
Okay.
It came out for the face and neck, but now you can do the whole body. So Morpheus is made by InMode. So
Okay.
this is the company that makes Morpheus. And so the reason I'm talking about it, we had to replace our machine because we just have used it so much. So when we got our new machine, it had this option for Quantum. And you know what, it was like not a lot to add it. And I was like, yeah, sure, I guess I'll add it. So I had to go do my training this past week for Quantum. And so now I know a lot about Quantum, and so I'm going to share with you guys. So as I said, the technology in these machines is nice. Morpheus is really good for tightening skin in a non-surgical way, and Quantum was designed mostly to decrease fat and tighten up soft tissue, which it gets very nebulous when you say, are you tightening skin or soft tissue? I mean, both tightening skin and soft tissue will have improvements in the appearance, but obviously soft tissue, which would be the fat underneath the skin, and the skin are different
So like
things.
what will like tightening the skin look like? Like what's the result of it? Like does it get rid of cellulite? Does it, what
It
does
can improve
do?
the appearance, yeah.
Okay.
I mean, something like Morpheus will improve the appearance of skin for sure. But like when you think about why something may not look the way that you want it to, it could look that way because the skin is loose. It could look that way because there's too much fat tissue, or it could look that way because the soft tissue underneath is starting to wear out. You
Yeah.
think about the breast when they sag. I mean, that's a two-phase thing. That's the skin stretching, but also the breast tissue stretching, right? Two separate things. So Morpheus, which I really, really love, only really addresses the skin.
Okay.
So this Quantum addresses the soft tissue part.
Okay.
And so that's how it's different. Because I wasn't really sure when they first came out and explained it to me. The person was good. Maybe I just misunderstood them. I didn't really know exactly what Quantum was doing, but I went yesterday and did training for it. And I do think it's good, so I'm gonna describe it. So what is Quantum? Well, it's radio frequency energy. We know that thermal energy causes remodeling of tissues, and it causes contraction. It also can reduce fat. So what this thing is basically a hollow rod, and we had a picture of it. And there's more pictures, you don't have to replace it. We're gonna throw some other pictures up there in a minute. But you make a very tiny hole, and some people just use a needle hole because the rods are very small. Some people will just do a little nick with a scalpel, so you end up with like a 2mm incision, so a tiny, tiny incision. You do have to put fluid in there to numb it, because this is done not in surgery. It's typically done in an office setting. So you put in fluid to numb it, and then you put this hollow rod in, and instead of using it up against the skin, which is the way that Body Tight and Face Tight work, I mean, have you guys heard of that one? Okay, so that's another one that's kind of popular. I don't love Body Tight and Face Tight, sorry, InMode. It's not my favorite. I've used it. I don't think it's bad. It's not my favorite technique. So body tight and face tight use the rod underneath the skin to heat it. This uses the rod, but the rod stays in the subcutaneous fat. Okay. And I think I got a picture, Trellis, of the procedure. Okay, yeah. So this is basically the rod there at the bottom, and it's showing the different levels that you're going to go through, and it shows the fibroseptal network, the FSN, and that's really what it's targeting. So this thing's doing two things. The thermal energy actually is causing fat cells to dissolve, but it's also causing contraction and tightening of the fibroseptal network. And so that rod basically goes through different levels. I think there's another pic to follow, Trey. Yeah, there. So this is showing it after you've done it. You see the red circles on the left, and then after a little bit of, 10% is the immediate drop in contraction from the fat, basically the fat that's burned off. And then kind of the late term, you get a 25% decrease in thickness. So I actually did use this machine yesterday, which is kind of odd. They actually had hands-on training, which usually you don't see that. And I liked it. I mean, it was, for me, because of my training, it was like pretty simple. I'm like, yeah, I kind of know what I'm doing, and just have to kind of go through the motions. So I used it, and it was pretty easy to use. It was pretty comfortable with the patient, not too bad. You do have to do wraps on this. I mean, it's considered minimally invasive, but there is post-op care. And so like with lipo where you have to do compression, you also have to do compression on this. It's not quite as long. The guy that was training me was saying that they do, I guess, a couple or 3 days of 24-hour compression, and then they go to like half days, basically meaning when you're home at night. The results, you will get about a 25% decrease after 6 to 12 weeks. And I asked him about the skin tightening, and he said it doesn't really tighten skin. It's more soft tissue contraction, and he likes to combine it with Morpheus, so it's doing a dual action.
That makes sense. It
makes sense, yeah. And so, I think combined with Morpheus, it probably could give some pretty good results. I think it definitely has some limitations. It only does 25% reduction, which there's a lot of patients that come in that 25% is not going to be enough.
Yeah.
And it's like, well, there's patients that if they really want to get the result that they are expecting, then they need to go bigger than
they need to just get liposuction.
Yeah, get liposuction. Then you have to go bigger than Quantum.
What would be like your perfect patient for
so that's a great question.
So I was like, and Morpheus.
I was thinking like, what would be the perfect patient? To me, the perfect patient would be the people that have a little bit extra fat tissue here called submental fat, or like little spot areas, like maybe like on your hip.
What about like me? If I came in and I was like, I want to get rid of like belly fat, like right where your belly button is.
If it was small, then it would be very reasonable. Yeah.
Okay.
But like what you don't want is somebody that needs like the 5 pounds removed.
Yeah.
Like the Quantum ain't gonna. I mean, it'll help, but like they're probably going to be a little disappointed on the back end, right? So this is definitely something where you have to pick your patients. And I got a couple of befores and afters. These are not mine. These are pulled off the internet. If you do before and after Quantum, that there. So I think I got 3. So again, this is kind of the exact thing I think Quantum would be good for. A little bit of extra fat.
Where else would you do it besides like the neck?
Maybe the arms, the hips, maybe abdomen. I wouldn't do it on the face. People are doing this on the face. I would not do this on the face. There is some people have told me that there's a risk that they've seen some nerve injuries from it. And here's another good one. I guarantee you these people are probably doing Quantum plus Morpheus. I mean that's just like a no-brainer combo because one's tackling soft tissue and one tackles skin. So yeah, I like that. Some people did the arms. That abdomen, I don't see a huge difference. I probably would.
It looks less like
full, maybe. Yeah. I mean, it went down a little bit.
It looks smoother to me.
Yeah, it's a little bit better.
It looks like all crinkly.
The arm
on the
looks
left.
better.
Yeah, the arm does look better.
Yeah, that one's almost a little unbelievable because the skin looks so much tighter. I'm like, is that real? Maybe. I mean, sometimes you'll get like a really great result.
Can you do like multiple? How many times can you do that to yourself?
I think that they're only saying do it once. It's not like Morpheus or Halo where you can repeat it.
Oh, so you're like.
Yeah, I mean, I guess. Well, actually, I don't know.
So like, if you got it like, 1 year, could you do it again the next year?
That's a great question, Sarah. I'm not 100% sure on that if people are repeating it. I'll find out for you.
Yeah,
to me, it's one where once you do it, like if you tried to go back and run that rod through after you'd heated up that fat, it would probably be a lot of scar tissue. So Could you do it? Probably. Would you want to do it? It would suck.
Is it recommended? Yeah.
Probably not.
Yeah.
Although maybe there may be people getting multiple treatments, but this is one where it seems like you do one treatment and it's done. Unlike some of the other ones where you repeat them to get the a little bit better result. So, but yeah, quantum. So we have it in our office. I haven't done it on any of my own patients, but I have some people that are asking to try it. So I'll kind of circle back around.
Yeah.
And see if we can get those. It'd be nice because if you can get good results and avoid surgery, I'm always a fan of that. You just have to be careful, right? With all of these non-surgical things, it's less predictable. Surgery is very predictable. Non-surgical things are not as predictable, and so it's like you hesitate a bit to be, oh yeah, do this, because if they don't get the exact result they want, they might be unhappy, and so that's why I kind of lean towards using it on people who don't have quite as big of problems.
Gotcha.
So
it looks cool though.
Yeah, cool stuff. All right, I think that is about all the time we have for today. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button and leave us a comment, and we will maybe do a segment on what you want to hear about on the next episode of Nip Talk.
Bye.